Good morning. I'm S.A. Suje, working as an assistant professor in the IDS department from SNS College of Engineering. Today I'm going to take a case study on unraveling the genetic basis of alkaptonuria, a rare inherited disorder from biology for engineers. The introduction is alkaptonuria is an extremely rare autosomal recessive genetic disorder caused by mutation in the HED gene. In this case study, explores the genetic basis of alkaptonuria through the real-life example of a patient, John, who has been diagnosed with this disorder. And here the case description is John, a 35-year-old male, presented with dark urine and joint pain. Upon further investigation, it was revealed that John's symptoms were consistent with alkaptonuria, a disorder known for the accumulation of homogeneous acid in tissues and urine, leading to joint and connective tissue problems. The genetic testing and analysis shows genetic testing was conducted, which identified two pathogenic variants in John's HED gene. These mutations disrupted the normal function of the HED gene, preventing the breakdown of homogeneous acid. Then the chromosomal abnormalities in this case were no chromosomal abnormalities associated with alkaptonuria. The disorder is primarily caused by specific gene mutations. The gene mutation shows the two mutations found in John's HED gene resulted in the deficiency of an enzyme called homogeneisate 1,2 dioxygenase. This enzyme is essential for the metabolism of homogeneous acid, leading to its accumulation in various tissues. Inheritance pattern is alkaptonuria follows an autosomal recessive inheritance pattern, which means that an affected individual must inherit two mutated copies of the HED gene, one from each parent, to manifest the disorder. Next is the genetic counseling. John and his family received genetic counseling to understand the implication of his diagnosis. It was explained that both of his parents must be the carriers of the mutated HED gene to have a child with alkaptonuria. Then the treatment and the management for the above diseases currently, there is no cure for alkaptonuria, but management involves symptom relief and monitoring. Dietary restrictions and physical therapy can help manage joint pain and complications. The ethical and social considerations are including the importance of informed consent for genetic testing and the need to maintain John's privacy and confidentiality. Additionally, John faced potential challenges in obtaining insurance due to his pre-existing genetic condition. At last, the conclusion on this case study is the genetic basis of alkaptonuria, a rare inherited disorder caused by mutations in the HED gene. Understanding the genetic underpinning of such disorder is crucial for diagnosis, genetic counseling, and potential future therapeutic developments. From this case study, we can see that is because of the disorder in the mutation of the gene. There are different kinds of disorders in the mutation of gene. One we can see here is alkaptonuria. Before case study, we have seen about the chromosomal disorder, and this one is the mutation in the gene disorder. So there is no remedy for this disease, but we can give treatment like the joint pain relief by giving some medicines, by giving some treatments, and we can give all those treatments and we can stop from more complications to the patient. So alkaptonuria cannot be cured but can be given treatment by giving dietary restrictions and physical therapy like some activities for the joints, for joint pain, so that we can avoid the complication from the disorder. We can see next case study in next class. Thank you.